Under Phase 1B of Wisconsin's vaccine plan, inmates are set to be one of the next groups up for coronavirus vaccine in March. But a proposed amendment to a legislative bill would put them at the end of the line. NBC 26's Kelsey Dickinson has more.
A controversial issue.
In my opinion, a mother of three should not be behind a murderer of three when it comes to getting this vaccine.
You know, they were not sentenced to death, and they were not sentenced to be exposed to a deadly virus.
The amendment to Bill AB 5 states that incarcerated persons under the age of 60 should not qualify for the COVID-19 vaccine until 21 days after it's available to the public.
The bottom line is that a law-abiding citizen should not be behind a criminal.
Representative David Steffen proposed the amendment, saying he believes young to middle-aged inmates should be near the end of Wisconsin's vaccine rollout.
As long as we have a demand that is exceeding supply, there's going to be some sort of line. I just struggle to understand why inmates, young inmates, should be receiving this vaccine before the rest of us.
One group aimed at ending mass incarceration says age shouldn't be a factor. They say what needs to be considered is living environment.
Our prisons are overpopulated, so therefore, there is no chance for social distancing in most prisons. And so again, you are, continuously spreading the virus.
According to the DOC, more than half of the state's roughly 20,000 prisoners have tested positive for COVID-19. 25 of them have died from the coronavirus.
Those people become sick, they go to the hospital, they continue to spread the virus to other people. So it's really to protect not only people that are incarcerated, but to protect the small communities that they're located in.
Assembly members will officially decide to include the amendment in AB 5 at a session Thursday. Kelsey Dickinson, NBC 26.